Well, good afternoon, everyone. Good afternoon, Dr. Christensen. Good afternoon.
Good afternoon.
And so welcome to segment one of our TV health channel. We're excited to talk today and our topic around health, but we just want to make sure that all the listeners from our Bloomberg, from our Jumpstart TV, our affiliate La Mega Mundial, Tempo, Callaloo Radio, and our newest installation, and that is on Roku. So we welcome each and every one of you to this important conversation, and we hope that you have your pencils and your paper to be able to talk about the subject of family caregiving from a number of perspectives. So let's welcome our guest, Yvette.
Hi, Linda and Dr. Christensen. How are you guys today?
2 thumbs up. That's all I can say.
Good. Dr. Christensen, can you hear us? Maybe she can't hear us.
Well, I don't know. She'll plug in just a minute.
Okay.
We're just really excited. I did want to say, yes, we're going to invite the guest on, but I guess we should do a little step back and talk about where we are with the whole concept of caregiving and this whole industry of caregiving as we prep up and introduce the guest. I know that you probably have been, I certainly have been a caregiver. And it is a very difficult position to be in because we're not skilled. No one gave us a book any more than we have as a parent. There may be parenting books out there. There may be family caregiving books out there. But when you're particularly in the sandwich years, caring for an elderly parent, caring for a young child, it can be very daunting if you're still a part of the workforce. And so we know there's lots of resources out there for us now. There's legislation that has been coming down the pike and in support, tax incentives even. But now we're going to hear a great perspective on how an organization really trains, selects, and then places professional caregivers into these homes and facilities that really make a difference to those who are being cared for and those who need the respite. We have Dr. Christensen back.
Yes. If
Live radio
keeps going, I'll probably just end up leaving, but we'll see how long this works.
That's okay. We understand in the viewing world of live television, live radio, we have to deal with the weather conditions that sometimes throw our systems off, but we appreciate all that we can do.
Yes.
So our topic, family caregiving.
Yes, we have all been there, I think, in some
Yes.
shape, form, or fashion, whether it was a parent or a child. And it can be a grueling and taunting task just to select a caregiver. I mean, we can even back up to making the decision to get a caregiver, right? Because we're 3 women, 3 strong-willed women, and we want to take charge and do it all. And you get to that point where you just can't do it.
Well, I think part of the and we have the heart desire because they are loved ones, but then we are not trained, even if you are trained as a professional clinician, such as both of you, and I get the training to help develop a feeding tube in my, relative, it's still daunting because there's someone that we love and there's someone typically in the home. Let's talk about what we do know from our experiences as we head into this conversation.
I can say my mother. Go ahead, Dr. Christensen. You go.
No,
first.
I had when I was out of my home for repairs, I was staying with a cousin, and she ended up being homebound, bedbound, really. And I was the only one there at the time. So it is a daunting task. It takes a lot of patience and but some firmness as well, because you have to bathe and turn, and sometimes it's very uncomfortable for the person, and you want to make sure they don't develop the cubiti. We talked about the ulcers, I think, last week. So it was very, very exhausting. But in the end, her sons came, and we actually got a caregiver. We were able to put her in hospice care. We were very fortunate to find a very good caregiver, but we still continue to help with the bathing and the different activities that needed to be done.
Yes. And you know, it's so fascinating as we think about caregivers usually are volunteers in your family. I mean, we are providing about 470, what is it, $1 million? I think that's what it came no, I'm sorry, billions with a B dollars in actual uncompensated care. So family caregivers, those who are family members or friends and relatives are filling a huge, huge gap. And so this goes in line with what we've talked about on this program many times before, and that is the gap in even clinicians, nurses, doctors, medical
Absolutely.
assistants, all others, where we just have to encourage that level of training and get more into the pipeline in the workforce. So,
Absolutely,
yes,
Linda. So our guest is in queue.
great.
Okay.
So we're excited about that. But I know you, Linda, had a caregiver for your mom. I had one for my mom. That selection process was beyond imagination as a nurse. You know, you think you got the right one, you walk in and there's sleep on the job. And I just went through so much. So I'm going to let Linda bring our guest up so we can kind of start unraveling this caregiving issue. I mean, it is a challenge. It's a necessary for a lot of families, especially now as we're all busy women, but we really need to proceed with caution.
And you know, it brings to mind something that I'm sure that many of us thought about or experienced or assisted in, and that is COVID-19, the pandemic. Can you imagine those members who had family members in their home, but because of the pandemic, the level of transport and fluidness to your physician just simply wasn't there? And you had to all of a sudden become a caregiver when you may not have been adequately prepared. And so the good news is that we have individuals like Mr. Thompson and the Well Healthcare Academy who are working diligently in this area, in this field, to identify, recruit, and train and place high level, high quality, high touch, high sensitivity individuals that support these families. Welcome to the program, Mr. Thompson. How are you today?
Can y'all hear me?
Yes.
We can.
Yes, we can.
We're doing a
Hello.
Welcome.
Hello.
I can't hear anyone. Let's see with the mic. Let's
Okay,
see.
well,
Can y'all hear me?
Turn your mic up.
Yes, we can hear you.
We can hear you. We can hear you. So while Mr.
Well, the
Thompson
mic
gets
is up.
well, are you on? And can you hear us? Can
I
you hear
thought
us?
I had this
One,
thing
two.
ready.
Let's see here.
Yeah,
Yes,
I had to
indeed.
turn mine up because when I came on. But
Well,
just
as
we
long
were
as
talking-
everyone out there can hear us, and we can't get up, we're just going to proxy everybody and say everyone out there in our viewing and our listening can hear us and
Okay,
really
let's see.
get absorbed
Can you
in
hear me
this
now?
conversation.
Yes.
we can hear you.
We
Can you hear us?
Well, I can't hear anyone. I see all the beautiful
Oh my
faces,
goodness.
but I can't hear anyone. But good morning to everyone. I'm delighted to be on the show this morning just to talk about care, the caregiving and how I derived at this point in my life to provide young people the opportunity to become certified nursing assistants, medication aid, phlebotomy, and dental assistant. And some of the students cannot get into programs because they don't have high school diplomas. So we also implemented a high school diploma program, a homeschool diploma program, where the student, I have to get their credits from their previous school, and then we get them a high school diploma. But my journey started with this school. My mom got sick, and y'all may laugh, but I'm a mama's boy. I mean, I have 4 sisters, and I'm a mama's boy, and 4 sisters, and I'm the only boy and the youngest. And for some reason, my sisters got lazy, and I was a single dad, so I knew how to comb hair. So that was sometimes I had to go to the hospital when she was in the hospital or at home and comb mama hair. And that was sometimes she would, use it on herself, and she was like, "Oh, baby, I don't want you to do that." I'm like, "Mom, I got you," and I had to get myself ready for that. So later years came on. I was in the private ambulance business at first. I had a private ambulance company in 4 cities and in Texas. And then when the ambulance service was dissolved, Then I got into the high school diploma, then into the healthcare career field. My degree is in healthcare administration, so I'm a hospital administrator by degree, which I served on as a assistant CEO for Bentop Hospital, which is one of the largest trauma centers in the world. And so I did that for a while. Then, of course, I started the CNA program. That program has helped so many people in the community, young folk that didn't really know what they wanted to do.
Mhm.
And of course, I looked at some of their grades when they came in with their high school diploma, and then I rolled them over to our CNA program, a phlebotomy program. But I was talking to a vet, and I was telling her how I can kind of gauge if a student is medical, if they're ready for the medical field. And I looked at their science grades. I looked at biology, physics. And if they made good marks in those fields, then I was like, yeah, you might be, ready. And another question I would ask the students was, if someone in your family you had to take care of and they use it on themselves, could you change them? They like, oh no. So if they said that, of course, that wasn't your field. Or if they were squirmish with blood, no, you couldn't do the phlebotomy program, and then the dental hygienist program. If they didn't like, well, nobody liked people with bad breath, but if they if they didn't want to look at people's mouths, then that was not a deal. So, but it has taken off. We've been doing this since 2007, and I tell you all, it has been a delight for me because in my ministry, while I'm a bishop, in my ministry, some pastors have prison ministries. Well, that's not my thing. My thing is education. And if I can help the family get to the next level, someone in the family get to mom, dad, child, get to the next level, then I think I've done something. Like Martin Luther King said, if I can do something, if I can help somebody, then my life would not be in vain. So these students, I mean, from me learning how to be a caretaker, it's still for me to want to help other people be caretakers. And so we are getting a lot. We have at least 10 people. We have a morning class, an evening class. So it's 10 in each class. And in the phlebotomy class, I only do like 5 in the class. The dental assistant, we do 5 in the class. So each one of those have morning and evenings. So, but anyway, the other side of caretaking, it's a wonderful thing. And it's kind of heart wrenching when there's no one, to take care of mom, take care of auntie, when there's no one there, because one day we gonna get old, and the fact is, I hope I have someone that's trained instead of somebody just fumbling over me, you know what I'm saying? Somebody just fumbling over. I want somebody that's trained that can help me, and so,
Bishop, can
okay,
you
I can
hear
talk
us?
too much, so preachers talk a lot. Can y'all hear me? Because I can't hear you guys at all.
Yeah, we can hear you.
Here.
Do you know where your mic is?
Your phone?
I need my earpiece.
No, your phone. You can call in.
Uh,
I see Mike, so I'm hitting Mike.
Well,
You're
while,
muted now.
Let's
yeah,
see.
well, while Mr. Thompson talks about it,
The mic is on there.
let me just
volume
commend
is up.
The volume is up.
him. I know that he can't hear us, and I wish he could. And while Yvette works on that, let's talk about why the program is so important. Because first of all, we know that a lot of individuals are not going to be making a gateway to college right away. So here's a program that not only at the Whale Healthcare Academy provides viable training with a career track opportunity, but does the workforce development lift into an industry that absolutely, without question, we have all suffered from, because there is just not enough caregivers who are trained, CNAs who are trained, medical assistants, and we could just go all the way up, rank and file to even physicians. And so we commend Whale Healthcare Academy because they're filling a gap, they're finding a solution. But what's really striking to me right now is that we're combining this education, right, with an opportunity to complete a high school diploma while providing viable job training and providing an opportunity for on-the-job training and placement. You cannot have a better set of ingredients in an organization heading into this. And I just think that you know, Mr. Thompson and his staff and faculty are doing an exemplary job. We encourage others who are in the community, who hear us, who have similar organizations, to collaborate, because as we close this infrastructure and the gap, wouldn't you say, Dr. Christensen, around this gap in the workforce, then we ultimately have the safety nets that we need to have in place. Mr. Thompson talked about something of his degree in health administration. And I come from the health administration side of the clinical equation. I know that you're a physician of 21 plus years, and we partner with physicians around how to manage healthcare systems. One of the challenges is in the recruitment, and not just recruitment, but recruitment of highly trained, highly motivated, highly skilled, and those who really see this as their own ministry or their career path. It's critical. So we implore, I don't know how to say it even, what's the strongest word I can use?
That's a good start. That's a good start. We beg, we plead.
we beg you. We really want that collaboration across the country, because healthcare systems they are part of larger conglomerate systems now. We're going by the wayside of community hospitals and regional hospitals. Those hospitals are being reabsorbed into care management organizations that are have a corporate office that are managing multiple hospitals, freestanding medical facilities, clinics, and physician practices under one corporate umbrella. It's that type of management.
Don't get me started on that. I said, don't get me started on that. But, you know, and this being a month dedicated to Alzheimer's and caregivers too, there's, the need is just growing. I'm reading there are about 6 million people with Alzheimer's just in that one case, not talking about the people who've had strokes, who are bedbound and also need the care, or have other other health issues that require them to have a caregiver. But it's expected that number is going to triple over the next 30 years. So that means we really need to increase our training of caregivers.
And we need to increase that training. We need to increase those job opportunities. And frankly, we need to really increase I don't know if cachet is the right word, but the prestige of, this very particular tier of caregivers. Because we don't want anyone to come away and walk away with this is my last resort job. This really is an esteemed, honored position opportunity, because you're doing something that is going to make a difference in individuals' lives. And that's where we want to have our young people feel good about what they're doing, not because they couldn't do anything else in life, but because they chose this as their career field. And
it can be a stepping stone as well. You start out as a CNA and you maybe go on to be an LPN or RN, or, so it's really a good opportunity. Now, I noticed that my Medicaid program here has started to pay for caregivers. And there's also legislation that is I think in the reconciliation, there's a provision in the reconciliation bill to do more training, as well as other legislation as well, but also to provide more support and more funding to increase the reimbursement for that kind of service, which, is also helpful.
Well, it frightens me a little bit. Oh, I'm sorry, Yvette. Let me just get my fear out. Can I give you my fear? Can I give you my fear? Listen, because right now, nonpartisan, we all have to be a part of this advocacy. When we think about caregiving from a formal, I remember being a part of the team initially that gave some strategy into the National Association of Caregivers, believe it or not, way back in the 1980s. I know I don't look that old, but hey. And so we literally had all of the nuances around caregiving, which was just not even a concept as something formalized. So it's really amazing to me that we have the Raise Family Caregivers Act, which stands for Recognize, Assist, Include, Support, and Engage, RAISE as an acronym. But that just became law on January 22nd, 2018. And my fear is that as we flip every one of these administrations, what's going to happen to that type of legislation? How is it going to improve and be available and assist those in the workforce who are training, like Mr. Thompson and his wonderful organization? You know, how are we going to continue this on and become strong voices and advocates for change?
I was just going to
Bishop
piggyback
hear
on,
us now?
can you hear?
I can hear you guys.
Great.
It's perfect now.
Okay, good.
Yes.
I hope you guys, can y'all hear me?
Yes.
We can. And we're so
Yes.
excited.
Hear you.
Good. I was just going to piggyback real quick on something that Linda had said about caregiving, the title being more prestigious than it is. But that starts with the whole hospital dynamics. And unfortunately, I can tell you as an RN and having been a supervisor, they're the lowest ones on the totem pole, but they do the most work. And it just seems so unfair. Just like, you know, as a registered nurse, we always would complain that during childbirth, we are there laboring with the women all the way till that baby crowns. That doctor comes in, the baby pushes, cuts the cord, and he's out. We're there 24 hours. We don't get any honor for that. But here comes this 15 minutes, the doctor. It's the same thing with the CNAs. They are there by the bedside. They are lifting, turning, feeding, hand holding, but yet they get paid the least and they do the most work. And I think that's one of the reasons why we don't get quality caregivers all the time, because they're like, why should I go through this when I'm going to be thought of, you know, in a lesser way, and I'm not going to make money for what I'm doing. So that's, you know, kind of my soapbox in the healthcare system. There's just some things
we're on that soapbox with you, because it is challenging. It is very, very challenging, because we have that across other industries, our teachers, our educators. My goodness gracious, none of us would be where we are without having an elementary, middle school, high school, college professor, and yet still. So your soapbox is appropriate. And so how do you, Mr. Thompson, how do you combat that? How do you recruit, inspire, encourage individuals into your program and therefore into the industry as a first stepping stone, a track into a full, robust healthcare career?
Well, first of all, I start out with motivating them and ask them, you know, what are their aspirations? And most of the time they want to start off at the top. I want to be an RN. I want to be an LVN, an LPN. They start out with that. And then I say, okay, you can get there, but how about let's start with this, with the CNA program, being a certified nursing assistant first. And if you like it, you can matriculate on to the LVN, the LPN, or the RN program. So the first step is motivating them and seeing where their head is, and if they're a good candidate to be a caregiver, because everybody is not a caregiver. So that's one of the things, is to motivate them to see if they're really there, if they're really concerned, because it's a lot of nurse nightmares, CNA nightmares, to where they're just there for a paycheck. And so what I also did in terms of caretaking, I took it to another level, because we'll get these students in after they graduate from my school or from wherever. We use United Way. We get them funding through United Way. We get them funding through the WorkSource here, Texas Workforce here. They fund them. So we get them funded through there. And that was a lot of red tape jumping. So I had to have a real love and passion for this, because they make you jump through so many hoops to get people to become a training school. So
let me just make sure we're clear for our listeners and viewers. Are these funding for scholarships to attend your program, or salary when they graduate, or both?
No, they are scholarships to get into the program.
Got it. Yeah.
To get into the program. And so once they get into the program, it's a 6-week program. It's menial. Well, it's not menial, but they have 6 weeks, 100 hours, 60 hours in class, 40 hours clinicals. When they finish that, we get them a certificate, and then they have to go to the state of Texas and take their state board. And then they become a certified nursing assistant or phlebotomist.
And is that typical you find across other states? Because our listening audience is quite extensive. We reach all the way into the Americas, part of South America, the Caribbean, and of course, North America. So would you encourage individuals to understand what are some of the qualifications within their state and country locations?
Yeah, well, of course, we all know, the regulations and all that stuff, it varies.
Mhm.
But the main thing for us here in Texas, what we had to do was, number one, get certified as a training school.
Yes.
Here in Texas, it is done through the Texas Workforce Solution. It's done through them. They deem you a training school. Once you get that, then you have to go to the state of Texas Department of Aging and Disability. Once you go to this Department of Aging and Disability, and you have all your documentation, your nurse has to have some LTAC experience, has to be an RN or LVN, LPN, and once you get all the documentation in, and what they're looking for is LTAC experience, your nurse, have the training facility. You have to set up a room just like a nursing home room.
Yes.
With the bed, all the operable stuff in the room, the sliding curtains and all that stuff. I wish I was at the office, but I had some stuff to do in the house. I could have
We're
showed
in
you.
COVID. We can get a visual. So it has to
Yeah, we got it.
mirror a hospital, what looks like a hospital room that we've all probably at one point in
It
time.
has to do, because then we get in that, they get classroom training, they get audio, video, and the clinical room that's set up like a nursing home hospital room is where they do their in-house clinicals, their skill tests.
Yes.
We get them their skills, and then after that, they go to a nursing home that I'm contracted with, and they get their training with the hands-on, the shaving. They get all the things. They get the shaving, how to shave someone. They learn how to turn a person in bed, how to change a person in bed, how to operate the gait belt, pick them up by the waist, the gait belt, how to properly lift, and then they get the documentation. They have to learn how to do the little charting. And something that Vet said meant it kind of registered with me. They are the lowest one on the pay scale in that arena, but heck, they do all the work.
Yes.
They do all the work, and my heart goes out. And I went a step further, but I think I shared this with you, that I started a staffing agency as well. So when my CNAs finished, my phlebotomy students finished, then of course I hired into my deal, and I pay my CNAs $20 an hour.
Wow.
Okay. So we've acquired 2 hospital contracts so far. So with that being said, we charge the hospital $29.50. So of course my company makes $9.50 an hour, and we pay the nurse, the CNA, the $20. So when my students graduate, they're coming to me.
Okay.
So let me ask you this question, because you are also Bishop, correct? And
I am.
So do you go by Bishop in at the Well Academy, Healthcare Academy, or how are you known in the community that you serve?
I'm known in the community, of course, as Bishop, but I have a PhD in health administration.
So you're also doctor. So let's just make sure we get all your amazing titles.
Oh my goodness.
You are doctor because you're brilliant and smart, and you have your PhD. Congratulations on that. Great.
Thank you.
Role model. You are Bishop because you had a spiritual center of worship that allows for any individuals to come and get that kind of healing. And wait a minute, you're entrepreneur and CEO of an academy, an instructor that allows individual. I mean, you're the trifecta. You are, wouldn't you say, ladies? I mean,
This community is very fortunate to have him.
You are too kind. You guys are too kind. My friends laugh. Just a side note, my friends ask, dude, do you ever get rest? And I say, absolutely, because I know how to shut the phone off, and I know how to go, and I love the water. I know how to go to the beach and sit around the beach, and y'all may think bad of it, but I know how to go smoke me a cigar and sit on the beach and just chill out, In
other words, you understand the concept of self-care, and we're not mad at you.
That's
right,
right.
ladies. We're not mad at you. And whatever your vices,
This is very important.
Self-care is totally necessary. It's totally necessary. So yeah, I have the PhD, the DD, churches in 4 states. But for the most part, my passion is care. It's caring for people.
So Bishop, I have a question.
Well,
so in the state of Maryland, once they complete your curriculum, right? They have to do an additional 40 hours here in the state of Maryland to become what we call a GNA, to be certified to work with geriatrics. We require additional training for that. Do you have anything like that in the state of Texas?
And can I hold Bishop Dr. CEO Thompson? We have a moment in TV land. We got to take a station break and give our opportunities to promote, but hold that really good question because that's important. So we will be right back with our TV segment number 1, health and wellness and lifestyle.
Great.
That was commercial music. Oh my goodness gracious. So we're back. And segment number 1, health and wellness and lifestyle of our TV with our special guest, Bishop Dr. Donald Thompson of the Well Healthcare Academy. So Yvette, take it away.
I was saying he was going over his curriculum for the CNAs in the state of Texas. And I was just curious, because here in Maryland, you go through the same curriculum. However, in order to work with elderly people, you have to take an additional 40 hours to become what we call a GNA, which means you're certified to work with geriatrics, which I think is crucial. Because it is a different population to handle as opposed to someone who's a little bit more agile like we are, and even children, because caregivers come for a variety of reasons. You know, mostly people think it's because you're aging, but not necessarily. You could have someone who's 20 or 30 that has a stroke, God forbid, and have to be home with a caregiver. So it's not always the elderly. So Bishop, can you share with me how you prepare your students to work with the elderly population? I know you said you had the contract with the nursing home, but is there anything additional that you do?
Well, I mean, tomatoes. It's basically the extra 40 hours. Um, we have a total of 100 hours. Like I said, it's 60 hours in class, and the 40 hours clinicals has to be the only place you can do the clinicals is in an LTAC, in a long-term care, acute care. That's their 40 hours of working in the geriatric community, because they're in training on the elderly, hands-on, with stroke victims, with just aging, dementia patients. They're dealing with the entire gamut of a person inside of a nursing home. So when you say additional, no, we have the 100, and it's inclusive in working with the geriatric community. You follow me? So there's no additional. It's one. We do 103 hours because we give them AED training. We give them their CPR, healthcare CPR cards, and we teach a little bit on ACLS. We kind of give them a little bit more, so we give them like 3 or 4 hours extra.
Okay.
So that they're really ready.
What's the acronym ELS for our listening audience to get a bit of education around these terminologies? LCS is
LTAC is long-term acute care.
I see.
Yeah, long-term acute care.
Because
And ACL.
Go ahead.
I'm sorry.
No, keep going.
It's like,
And of course you have the ACLS. That's just all the monitors and things of that sort. We just give them just a tidbit on how to monitor those devices and stuff. Right.
That's critical. So have you found where families would want to come to the academy, as an example, where they just want to actually learn how to, like, family member off the street who wants to come and learn and take that 100 hours, or get some basic rudimentary on how to become an effective caregiver alongside the professionals that you are certifying, where they walk in, like myself, my siblings, we could have benefited from more than just let me give you a quick rundown on
Sure.
how to insert a feeding tube and what to look for in the monitor. And, even my kids got involved, how to help, how to be responsive, but more how to not create harm. That was where we really were frightened. How do we not create and exasperate the healthcare issue that we were attending to our mother in particular? Would it be appropriate for someone like myself to come in and say, hey, I just want to get some training?
Yes, yes, and that happens a lot. My mom, this is new. Mom has come home. She's totally bed confined. She's bedridden, and the daughter come in and say, hey, Bishop, I want to, get in your program. I said, well, it's a license. I'm not really concerned about the licensure. I just want to get the training. And I said, why go to the training? You can get your license, because of course you can get a job anywhere doing CNA. They always hiring. So yeah, that there is some cases where they just come get the training, because we have to understand that skin tears they're real. When you get old, your skin gets soft. So they have to show them how to actually maneuver this 85-year-old woman, because her skin, she gets skin tears easy, and then here we have with the Cuban. Then we have we maybe not the Cuban, but then, well, yes, you do it wrong on the rear side. But yeah, then you got the cubitus, and then you got infection set up because you didn't know how to handle that patient, or they didn't clean them well, and now in the genital areas, they're raw because you didn't get all the feces out. So now they got all type of bacteria infections. So we teach them how to. We have a full body mannequin that actually they do all the wiping. They learn how to clean the male organs and the female organs to clean good. You got to pull stuff back and wipe. So they get that intense training in-house before they go, because when you get there, I don't want somebody inexperienced dealing with my mom, picking her up and snatching on her, and then now she got a tear on her arm. I don't want that for me. So I make sure that our nurses, and I'm so fortunate that my 3 nurses that I have, they're retired nurses. They were getting ready to retire their licensure.
Oh.
And they are teaching these students because they got 40, 50 years experience as nurses. So I was fortunate to have them, and they love it because it's 3 hours a day, Monday through Thursday, and so they enjoy teaching the young folk.
Yes.
So I was extremely fortunate to have the seniors that's in there. Don't mean harm, because I'm 57. I'm almost a senior.
You're in the
But,
club with us
yeah.
now. You're in the club with us, Bishop. And,
Right.
I love that 360-degree touch. Those who have excelled in their careers as RNs, in this case with your instructor corps and yourself as administrator, and being able to circle back around to the next generation of healthcare workers as they start their track in this long healthcare career opportunity that really is available. What types of support do you have out in the community in terms of types of partners, types of special interest groups? I mean, I know that you work with the local Department of Aging, but many times nonprofits such as yours need to have donors and contributors. What types of corporations are supporting you or not? What can you say across the board to not only, what your needs are locally, but organizations like yours across the country and in our other listening areas?
Well, there's per se, and we are a nonprofit. I run all my schools through my church, so we are a nonprofit. So have I found any partners out there that say, hey, I want to give scholarships to X amount of students? I take that back. I'm getting ready to open up another location, which is going to be totally free. It's going to be the Well Academy of Health Careers, but a philanthropist. You remember George Floyd, right?
Yes. Oh, yes, we do.
Mm-hmm.
Okay, so the George Floyd Foundation, I serve on the board, and that was a philanthropist that gave $16 million to the cause of that particular community that he grew up in. Mm-hmm. And in that is also my Masonic Lodge, where I serve as a worship master. We're in that $16 million. So what they wanted was in the community, this particular zip code 7004, everybody that's in that community can come in free and get the diploma and get the nursing program. And we had a meeting. I'm like, well, how you guys going to pay me? It's going to be free. I mean, it's like this, don't worry about it. So they're blocking out every quarter $100,000.
Wow.
Okay. And so I'll get the monies from what I have to go out and do my marketing, and I have strange marketing. Let me just insert this. I have a strange marketing deal is where I actually go to the nursing homes, and they was like, hey, why are you going to the nursing home? They already CNAs. I say, well, no, there's housekeeping.
Right.
That may want to be a CNA. There's the dietary people.
Right.
That want to be that. There's a nurse that's in there. They have a daughter or son that want to be CNAs. So that's one.
Are retraining or getting, having retraining under your methodology and support, and to have that cohort. So there could be that as well, because it's an ongoing learning experience.
It is. Exactly. I have been trying, guys, what I've been trying to do is get with nursing homes because there's a shortage.
Yes.
In the nursing homes. Yes. Nursing homes do not want to pay a staffing agency, but you need nurses. Now we're not getting the proper care because we don't have the proper staff. And you all know about not being proper staff. They don't work the snot at you.
That's right.
Yes.
It's not properly staffed. So what I found is that I had one deal that could have worked out, and we're still working on it, where this chain of nursing homes.
Yes.
I was going to start a class inside of their nursing home, and they pay half of the students' fees, and the student pay the other half. So
Bishop, can I ask you a question? Because right here, and I'm just hogging it, so I'm going to let my colleagues have some time, because this is just so mind-boggling to me, because my mother was a caregiver to her father, and they lived in different states, and it was just excruciating. And we were young, but she did it. And then I turned around with my siblings, and we were a caregiver to our mother and thought we were well prepared because we thought we had all the information, and then found out that we had to navigate through this entire healthcare landscape. And even as someone sitting in the hospital. But one of the things that we relied on was our church community. And so, Bishop, my question, I know here in the Washington metropolitan area, we have very large churches that actually have already established nursing homes and living assistance as part of the umbrella of services, if you will, to the community and their members. How do you link up the interfaith into this process of establishing not only career opportunities, but doing 360 in terms of caregiving? How do we create this entire community response around this whole issue of caregiving?
In terms in the religious communities, was that your question? In the religious community?
Correct. That's correct, because that's where we turn to. We turn to our care ministries. We care to the people who are inside of the church, who are nurses or physicians, or we turn to our pastoral care to just help us navigate. But how do we link it up? How do we become that much more cohesive and comprehensive in having that partnership with the interfaith community?
Right. Well, there are some churches, some large and small congregations that have caregivers ministry, and we have an opportunity. I've had the opportunity to where a pastor friend called me and said, "Hey, man, you still doing the CNA thing?" Excuse me for being so free with that, but are you still doing the CNA? Absolutely. Can I give you a number? And there's several of our members that need caretakers in the home.
Yeah.
And so that's how that has worked. And it's always, of course, it's ongoing. When there's a need, they'll call me and say, "Hey, I need some CNAs, or I need well, mainly just the CNAs for that, but in terms of caregivers. So yeah, we need some CNAs. So yes, that's how we link up with them. Is basically upon request if they need it. So how can we get in there more? I mean, it's really based on a need. It's not, of course, there's a need all the time, but not just in one place. They come from, different churches, and of course we're there, and we'll send some CNAs to them. Or if the parent has the elderly, if they have a home healthcare agency, then I will refer my student over to that particular personal care, the home healthcare agency, and they'll sign them on, and then they can be the caregivers that way. And the same thing with the churches. They'll say, "Hey, mom has a personal care home."
Yeah.
Not a personal care, but they need a caregiver. So then I'll get on the phone to that particular service and say, "Hey, look, I have a nurse. Do you need them?" "Yeah, come on." And so they sign them up. So I guess that's what we do there.
That's
in terms
great.
of the religious community.
It almost feels like there needs to be a memorandum of understanding so that there's no gaps with all the first responders who are responding and walk into homes and they realize something's amiss here. We have an elderly or we have young people who really need the support and care but have not been referred out to community services. We have the interfaith community where they have the home visits, to check on your parishioner, and then they discover that there's an issue in the home and they need to have an immediate response. And maybe the healthcare system isn't necessarily, but rather someone that can respond at, provide some basic services as a CNA, as an example, and then connect them back into the healthcare system. And then because we live in a society where hospitals are now taxed in their reimbursement scheme with making sure that their patients who are discharged are connected into community health services, so they don't come back into the hospital after a certain amount of time. In Maryland, it's if you come back within 30 days for any other issue, that hospital may not be reimbursed.
Right.
Using federal funds. So on that 31st day, you walk in with a new issue, but making sure those hospital systems connect into an organization like yours as part of that network of care and response.
Well, this time is critical. This is a very critical time because as adults about our age, we're going home for the holidays.
Yeah.
And we see that mom and dad are not doing so well.
Yeah.
And then we look to agencies or we look to get help, especially if we live out of state, because we realize they need someone to care for them. So the holidays is a real critical time to observe your loved one to see if they need a caregiver. And I think that Linda, you were out of town when we had a guest who has a home health agency here in Maryland, who was giving people 2 hours of free time just as respite to introduce them to what caregiving is like, you know, whether they just went to lunch or got their hair done, sat out in the backyard and had a cup of coffee. That was her ministry, to give 2 hours of respite to any family in the Maryland area that needed it. And I thought, wow,
That's very needed.
Wow.
what a blessing.
You
I'm hearing Bishop, and he's, you know, bringing people in, and now free scholarships. I'm like, oh wow, it's all about giving back. So Bishop, I just want to commend you before I turn this back over to Linda, and you know, also share with our viewers. It's just such a wonderful feeling. I know that a couple of weeks ago, Linda and I had an opportunity. We sent someone to Vegas, and she called yesterday and she said, I know exactly what I want to do with my life. I wasn't sure. She says, but I know now I was meant to be a nurse. And that blessed me that I was able to be a part of that decision making, that, you know, I don't want to just be a CNA. I want to take my career one step further. And thank you for you know, giving me that opportunity to see that it's not about just being in a hospital. There's so many different avenues that you can take.
There's so many different avenues. I mean, what are some of those, you know, because sometimes we do get tunnel vision, and even I have. I mean, this conversation has actually broadened my mindset, even in mentioning children who have healthcare issues, where a parent really just feels overwhelmed and needs the respite or needs the skill or needs a professional to be in the home, to the elderly who are suffering from a variety of different issues, and every single person in between. Is it out of thought to have a CNA who works with and supports those who are actually not physically, but mentally have issues and challenges and need that type of support? Or is it just physical? Are we primarily CNA for those physical health issues? Help us understand the delineation around levels of care.
Now, there are right here in our area, Volunteers of America, those were for the intellectually disabled. Those aides took care of the intellectually disabled, because most of them could be 30, 40, 50 years old and have the mind of somebody too. So in that case, they had a CNA that took care of them, and, you know, went with them to doctor's appointments or to dentist appointments or to their, what we call adult daycare centers. They had to have a lot of one-on-one attention to get that done. I'm not sure.
We used CNAs helped us out a lot during the COVID, during the pandemic, and still are as contact tracers and filling a lot of different roles, but mainly the contact tracers or the people at the phone answering the emergency lines to get people into testing or to where they could get their vaccination. So we were able to hire CNAs for that. And the program that the bishop probably used is, I'm sure, available through the Department of Labor, because we have that training program here with the stipends, and I think we're doing some CNAs. I was referring one of my dentists who needs more dental assistance, to see if we could develop a program like yours with the dental assistants. And one other thing I just wanted to say, because you were, Linda, you were saying, well, with the changes of administrations, things continue to be, these issues can be continued to be worked on. Well, some of the members of Congress stay on and on and on. And Maxine has been working on caregivers for a long time, and hopefully the time is ripe for her to have her particular Alzheimer's Caregiver Act that's in the House and Senate now. It's bipartisan, so I think finally it'll get done.
Well, we just thank you so very much. Those are very important topics. And I see that we have Mr. Anthony Weeks in our view, which tells us that we are already out of time. That went by
Yes.
so fast.
So fast.
Mr. Donald Thompson of the Whale Healthcare Academy in Texas, we are so delighted that you were able to join us today and talk about this very exciting program. Let us know how folks can donate to you. How can we donate? What's the website where they can go and make a donation to help expand your program in the community?
Well, right now there's what we have is just of course our Cash App and our Zelle, and the website is the Well Academy, the Well Academy of Health Careers.com. Or they can go to the Cash App Church Well, $ Church Well, and my for Zelle is 832. If you all want to write it down, 832-880-9398. Let me add this. This was ringing in my mind. I know we're out of time, but if we want to really make a change, then I think we need to get with our legislators to raise just like the minimum wage period across the board, and mainly get some lobbyists, and let's go to our state capitals and lobby for these caretakers to get more money. And I think that's what's really missing. Enough people are not lobbying for these CNAs to get more money, because they are the backbone in these nursing homes and these hospitals, which was said previously. And thank you all so much for.
I understand it's coming, Bishop. So let's keep putting that pressure on so it gets done.
Yes.
I agree with you. It's not going to happen without us pushing.
Without us pushing. We can talk about it all day long. And I'm a firm, one of my favorite sayings is, don't talk about it, be about it.
Yes. Thank you.
That is it.
Thank you so much, Bishop.
Okay.
Thank you. God bless
Anthony's
each of
being
you.
very patient with us, but I know he has to go to his next show.
Yes.
Yes.
And I have another
Thank you.
meeting. So thank you, Bishop.
Thank
Thank
you.
you, everyone. I'm going to
You're
get
very
out.
welcome. Thank you, guys.
Thank you so
Much
much,
love.
everyone. Great job. Thank you so much. And coming up next, segment number 2 on our business, markets, and economy and public policy. This is Anthony Weeks, and of course, my colleague Jessica Kyla. Thank you, ladies. Thank you, our guests, for being part of the program. We'll talk to you next week. Of course, I'm talking about the segment number 1 on our health, wellness, and lifestyle. We'll talk to you guys later.
Bye, guys. Good to see you.